Hey everyone, welcome back to Speak Healthy. Today, we're going to talk about vitamin D and the main symptoms of being vitamin D deficient. In today's fast-paced world, there are many health concerns that people face. One of the most common issues is vitamin D deficiency. Vitamin D is a crucial nutrient that plays a key role in maintaining bone health, strengthening the immune system, and regulating mood. However, due to various factors such as insufficient sun exposure, diet, and lifestyle choices, many people struggle to get enough vitamin D. In this video, we will explore the symptoms of vitamin D deficiency, its causes, and ways to prevent or treat it. Number 1. Bone pain and muscle weakness. Bone pain and muscle weakness are two of the most common symptoms of vitamin D deficiency. Vitamin D plays an important role in the absorption of calcium and phosphorus in the body, which are essential for bone health. Without adequate vitamin D, the body cannot properly absorb these minerals, leading to a weakening of the bones and increasing the risk of bone fractures and osteoporosis. Muscle weakness is also a common symptom of vitamin D deficiency. This is because vitamin D is essential for the proper functioning of muscles. When there is a deficiency of vitamin D, the muscles become weaker, and this can lead to pain and discomfort, especially in the legs, hips, and lower back. In some cases, muscle weakness can be severe enough to interfere with daily activities and make it difficult to perform simple tasks like climbing stairs, getting up from a chair, or even walking short distances. This can have a significant impact on a person's quality of life and can make it challenging to stay active and maintain a healthy lifestyle. Number 2. Fatigue and low energy levels. Fatigue and low energy levels are other common symptoms of vitamin D deficiency. Vitamin D plays a critical role in regulating the body's energy levels by maintaining the balance of calcium and phosphorus in the blood. When vitamin D levels are low, the body may not be able to produce enough energy to carry out daily activities, which can lead to feelings of tiredness and exhaustion. Low energy levels can have a significant impact on a person's quality of life, making it difficult to complete tasks, concentrate, or maintain productivity. This can result in a loss of motivation, decreased work performance, and may even lead to depression. In addition to feeling tired and lethargic, vitamin D deficiency can also affect sleep patterns. Low vitamin D levels have been associated with sleep disturbances such as insomnia and restless sleep, further exacerbating feelings of fatigue and exhaustion. Number 3. Frequent infections or illnesses. Frequent infections or illnesses are another common symptom of vitamin D deficiency. Vitamin D is essential for a healthy immune system, which helps the body to fight off infections and diseases. When vitamin D levels are low, the immune system may not function properly, increasing the risk of infections such as colds, flu, and respiratory tract infections. Research has shown that people with vitamin D deficiency are more likely to experience respiratory tract infections, including pneumonia and bronchitis. Vitamin D also plays a vital role in reducing inflammation in the body, which is an essential component of the immune response. When vitamin D levels are low, inflammation can increase, leading to a range of chronic diseases such as diabetes, heart disease, and autoimmune disorders. In addition to supporting the immune system, vitamin D also helps to regulate the expression of genes involved in immune function. This means that vitamin D can help to modulate the immune response, preventing overactivity or underactivity, both of which can lead to increased susceptibility to infections and illnesses. Number 4. Difficulty thinking clearly and impaired memory. Difficulty thinking clearly and impaired memory are other symptoms that may be associated with vitamin D deficiency. Vitamin D receptors are present in the brain, and research has shown that vitamin D plays a crucial role in cognitive function and memory. Low levels of vitamin D have been linked to impaired cognitive function and a higher risk of developing dementia and Alzheimer's disease. A study published in the Journal of the American Medical Association found that older adults with low vitamin D levels were more likely to experience cognitive decline over a 3-year period. In addition to supporting cognitive function, vitamin D is also essential for the production and release of neurotransmitters, such as serotonin and dopamine, which play a key role in regulating mood and emotions. Low levels of vitamin D have been linked to depression and anxiety, which can further impact cognitive function and memory. Number 5. Depression and mood swings. Depression and mood swings are additional symptoms that may be associated with vitamin D deficiency. Vitamin D is essential for the production and release of neurotransmitters such as serotonin and dopamine, which play a crucial role in regulating mood and emotions. Low levels of vitamin D have been linked to an increased risk of depression as well as other mood disorders. Research has shown that individuals with depression often have lower levels of vitamin D compared to those without depression. A study published in the Journal of Clinical Endocrinology and Metabolism found that supplementing with vitamin D improved symptoms of depression in individuals with low vitamin D levels. Furthermore, vitamin D deficiency has also been linked to mood swings, irritability, and anxiety. This can be due to the role of vitamin D in regulating the activity of the hypothalamic-pituitary-adrenal (HPA) axis, which plays a key role in the body's response to stress. When vitamin D levels are low, the HPA axis can become dysregulated, leading to mood swings, anxiety, and other symptoms. Number 6. Hair loss or slow hair growth. Hair loss or slow hair growth are additional symptoms that may be associated with vitamin D deficiency. While the exact mechanism is not fully understood, research has suggested that vitamin D plays a role in regulating hair growth cycles. A study published in the Journal of Stem Cells and Development found that vitamin D helps to regulate the expression of genes involved in hair growth, as well as the proliferation and differentiation of hair follicle cells. Low levels of vitamin D may therefore lead to impaired hair growth, thinning hair, or hair loss. Furthermore, vitamin D deficiency has also been linked to conditions that can cause hair loss, such as alopecia areata, an autoimmune disorder that causes hair to fall out in patches. A study published in the Journal of Investigative Dermatology found that individuals with alopecia areata had significantly lower levels of vitamin D compared to healthy individuals. Number 7. Impaired wound healing. Impaired wound healing is another symptom that may be associated with vitamin D deficiency. Vitamin D plays a crucial role in the immune system, and research has shown that it is essential for proper wound healing. Vitamin D helps to regulate the expression of genes involved in the inflammatory response and immune function, which are critical for proper wound healing. Low levels of vitamin D have been shown to impair the immune response, which can lead to delayed wound healing and increased risk of infection. A study published in the Journal of Investigative Dermatology found that individuals with low levels of vitamin D had a higher risk of developing chronic wounds, such as diabetic foot ulcers, and experienced slower healing times compared to those with sufficient vitamin D levels. Furthermore, vitamin D deficiency has also been linked to an increased risk of infections, which can further impair wound healing. Infections can cause inflammation, increase the risk of scarring, and delay the healing process. Number 8. Back pain. Back pain is another symptom that may be associated with vitamin D deficiency. Vitamin D is essential for bone health, and low levels of vitamin D have been linked to an increased risk of musculoskeletal pain and conditions such as osteoporosis, osteomalacia, and fractures. Research has suggested that vitamin D plays a role in regulating calcium absorption and bone metabolism, which are critical for maintaining strong bones and preventing back pain. Low levels of vitamin D can lead to weakened bones, which can result in chronic back pain or make existing back pain worse. A study published in the Journal of Endocrinology and Metabolism found that vitamin D supplementation improved back pain symptoms in individuals with low vitamin D levels. Another study published in the Journal of Clinical Endocrinology and Metabolism found that vitamin D supplementation improved bone density and reduced the risk of fractures in older adults with low vitamin D levels. Number 9. Brittle or soft bones. Brittle or soft bones are a more severe symptom that may be associated with long-term vitamin D deficiency. Vitamin D is critical for bone health, as it plays a crucial role in regulating calcium and phosphorus absorption, which are essential for building and maintaining strong bones. When vitamin D levels are low over an extended period, the body may not be able to absorb enough calcium and phosphorus from the diet, leading to weakened bones that are susceptible to fractures. In severe cases, this can lead to conditions such as osteomalacia or rickets. Osteomalacia is a condition in which the bones become soft and weak, making them more prone to fractures. This condition is more commonly seen in adults and is characterized by bone pain, muscle weakness, and difficulty walking. Rickets, on the other hand, is a condition that affects children and is characterized by weakened and deformed bones, which can lead to stunted growth, skeletal deformities, and muscle weakness. Number 10. Decreased immune function. Decreased immune function is another symptom that may be associated with vitamin D deficiency. Vitamin D plays a crucial role in the immune system, and research has shown that it is essential for proper immune function. Vitamin D helps to regulate the expression of genes involved in the immune response, which are critical for fighting off infections and diseases. Low levels of vitamin D have been linked to an increased risk of infections, autoimmune diseases, and even some cancers. A study published in the Journal of Investigative Medicine found that individuals with low levels of vitamin D were more likely to develop respiratory infections, such as colds, flu, and pneumonia. Another study published in the Journal of Autoimmunity found that vitamin D deficiency was associated with an increased risk of autoimmune diseases, such as multiple sclerosis, rheumatoid arthritis, and type 1 diabetes. Furthermore, vitamin D deficiency has also been linked to an increased risk of certain cancers, such as breast, colon, and prostate cancer. Research has suggested that vitamin D plays a role in regulating cell growth and differentiation, which are critical for preventing the development of cancer cells. Increasing your intake of vitamin D through diet, supplements, or exposure to sunlight can help to support immune function and reduce the risk of infections, autoimmune diseases, and certain cancers. However, it is important to remember that maintaining good hygiene, getting adequate rest, and following proper medical treatment protocols is also essential for maintaining a healthy immune system.